So, dear participants, I welcome you all to the third day FDP. And in this session, our research person is Professor Maninder Singh. So now I request Abhishek Mishra to present his introduction. Abhishek.
Yes, sir.
Also, sir.
So in this session, the research question is Dr. Maninder Singh. Dr. Maninder Singh is an accomplished academic and researcher with expertise in medical image processing, artificial intelligence and Internet of Things, and antenna design. He currently serves as assistant professor at the Symbiosis Center of Medical Image Analysis, Symbiosis International Deemed University, Pune. With more than 4 years of experience with both research and teaching, he has been at the forefront of innovation in biomedical imaging and AI-driven healthcare technology. Dr. Singh earned his PhD from Motilal Nehru National Institute of Technology, Prayagraj, where his research focused on developing computer-assisted detection system for ocular biomarker in trauma care, with an emphasis on real-time monitoring of intracranial pressure using AI techniques. His research has been published in reputed journals and international conferences, and he holds a granted patent for an IoT-enabled system to predict elevated intracranial pressure, a treatment to his innovative contributions to medical technology. Through his international research, Dr. Singh is contributing significantly to telemedicine, remote patient monitoring, and intelligent healthcare system, effectively bridging the gap between engineering and medical sciences. So, I welcome you, Professor Maninder Singh, this session, and I hope all the participants will enjoy this session. Sir, kindly share a screen, please.
Yes, sir. Thank you for a nice introduction. And firstly, I would like to thank AICT and your organization, SIUUT. So, can I share the screen?
Yes, sir, please share.
Okay, sir. Just a minute. Okay. Is it visible?
Yes, sir, it's visible.
Okay. I just put the screen. Just. Do not have this. Is it visible in full view?
Yes, sir. Yes, sir.
Okay, sir. So, good evening, everyone. So, the topic for today's session is from trauma to diagnosis, deep learning applications in ocular imaging. So, in this talk, I will be focusing on how the deep learning applications can basically support trauma care by analyzing the ocular imaging, and the focus of this ocular imaging will be wait a minute. Sir, can they mute someone? Hello.
Yes, sir, continue.
Okay, sir. Okay, so the talk will be focusing on how deep learning can support trauma care by analyzing ocular images such as ultrasound imaging or a fundus imaging. Okay, to estimate an important biomarkers that can guide diagnosis and treatment. So, to basically understand this topic, I start with the basics like biomedical systems and an AI, artificial intelligence. So, as we know that biomedical systems basically is a system where engineering and medicines both comes together, and the focus basically lies in developing new devices for improving human health basically. And while designing a device or anything, so we need a particular the basic idea should be a good design basically, that can make device practical and user friendly. Moreover, the second important thing in a device which is there is a sensors part nowadays. So where we can say that the sensors can capture signals from the body, and you have seen such examples like capturing through the wearable devices like heartbeats or brain activity type activities like we say. And further, after capturing such signals, the next idea is to process that information through smart computing and further analyze stored those information. And when we got analyze those information, we transfer those information to the clinical way, where we ensure that wherever we ensure that the technology which we develop should like help patients and support doctors in making a better decisions basically. So together these four elements which I talked, like design, sensors, computing, and clinical knowledge, which is very important basically we say. And you can see in a real time biomedical systems which we use in our daily life. Suppose we went for a office also or in institutions where biometric systems are there, and these are like basically based on AI on AI we can say, because it's a like deep learning is a sub part of AI. And so we see that a, bio, a biometric, basically whatever is installed in institution, it basically consists of a facial recognition they just capture, or a fingerprint scans. Moreover, in a healthcare also, we just say that wearable devices just track our health activity. And there are a lot of, like you see, the apps are there developed and getting tracking and using the navigation system, the language translation. Moreover, virtual assistants which are available like Siri and Alexa, we generally use. So these are like a real daily life. We use these tools basically. So the idea now this all the idea has been now been same idea been adapted for the healthcare system, where a deep learning for uh, medical imaging is very important. And through that we know that we can the common analysis like ECG analysis is a very like common terms we used to hear about it. Moreover, we just moving with through this AI in healthcare to the robotic automations also, and through the virtual assistant we are going for managing e-health records, basically we just talk about. So what I need to say that this artificial intelligence is basically reshaping the overall biomedical systems, because what we see in previous these biomedicals, like they are mostly a passive in nature basically. Generally we simply record the data and through the instrument, and then display particular data, and then all the interpretation has been done. So if I if I talk about AI system, so AI system basically automatically analyzes the pattern, and it highlights the abnormalities which generally occurs in a patient, and then predict that it is risk or not risk instantly. And here you can see I have shown one of the image basically. So it is the application of deep learning framework taken from a paper I just cited here. So you can see that one of the area where AI has made the biggest impact is the medical imaging or a healthcare area, you can say. And it shows that deep learning model are used across almost every organ system, we can say, from brain to the heart to the eye. And here the task which we used to perform in diagnosis basically through this imaging system. So you can see at the right side we have written here segmentation, pre-processing, monitoring. So these are the common key task we used to perform basically. You've heard about that. Firstly we need to acquire the image acquisition, then simply we pre-process the image, and then further segmentation if we want to do, or classification or detection, then we move to the And for that, there are many deep learning models basically. And this revolution basically starts, we all know that with the convolutional neural network, or we generally popularly known as CNN we called. But over time, we say that like most of the models has been become dominant, like UNET in medical imaging for segmentation task, and then it came to the mask RCNN. Okay, so further we move to the faster RCN, and also the previous we will just study about its history and all that. So what we noticed there that these all the methods were being used to in certain medical areas, which we see on the right side, like neuroradiology, dermatology, and ophthalmology, breast cancers. These are popular one I can say. And the important thing we need to point out that overall, whatever the AI systems are developing uh, for the healthcare, they do not just generally replaces the clinicians, and it act as an decision support system for the doctor basically. So basically, what I need to particularly highlight that this whatever the imaging we capture basically, and I talk about the ocular ultrasound and fundus, basically two imaging which I will be talking in this session. And these imaging and what are the important biomarkers in this imaging will provide a first clue to the life-threatening condition, and that will help doctors immediately and help in objective analysis in critical moments. So here in the figure you can see here that in neuroradiology, lot of advancement has been done, and most of the methods like in dense net, here you can see here dense, this is the neurology. So here it is showing that how the most of the models are like dominant, like LSTM, DNN are important, and these are some other models has been used for neuroradiology. So it is generally a heat map basically showing everything. So when I move to the trauma itself, like in neurology, there are a lot of parts, but the common part, like trauma, I'm just discussing in this session. So, among the various neurological diseases, this is some statistics there. That like you can say, in a graph see that there are multiple sclerosis which can be a traumatic condition, or a Parkinson disease. Alzheimer is then people are working on stroke and a brain injury. But according to the Lancet Commission report was there, one of the like study was in literature, and it was found that this brain injury is expected to be among the top three injury related causes for death and disability until 2030. And moreover, there are statistics has been taken out where the number is staggering. Like you can see that 2,14,110 TBI patients related hospitalization were in 2020, and similarly around 70,000. The figure is 69,473 related deaths in 2021. And the shocking thing is that that in USA this figure turns out to be 1 out of 200. While when we talk about the India, this is 1 out of 6 trauma victims are generally dying each day. Basically, I want to say that. So how important is this this traumatic brain injury? And the we can say the major cause for such figure is basically that in India you can say that there is a delay in traumatic brain injury care. And important thing is that 95% of trauma victims in India do not receive timely and adequate care. And if you think about like it's a general way that in a rural area, some we take some example, and if suddenly you get some road accidents, so the major causes you can think about it. What are the major causes? The firstly is that if we say that if we got injured like badly, so there is no emergency department we can say, and because of that in rural and remote areas where this lack of emergency department is there, it is difficult to assess trauma condition promptly. Moreover, if let's assume that emergency independent, but other the things which is there needed, that some skilled person is also not there in the rural areas. and due to which if some person is also available at assume also, but that is lack of specialized skill for accurately measuring the biomarkers which is needed significant for that particular issue. Moreover, when we talk about monitoring, like if maybe in some places if there are emergency department or other things also, but the current process for monitoring and diagnosing trauma condition is time consuming, because the conventional practices which are there, that are for trauma cases, are invasive in nature. And what do I mean by invasive? You already know that invasive like techniques which are there, that are very high risky, and it is the equipment which is associated with it is costlier. Moreover, so what I can say that there is non-availability of automated system, and if all these things are delayed, then you see the person which who got injured in the road accident in some village or somewhere, and all these things are not there, then by the time he reaches somewhere to the hospital, it is too much delay, he may lost his life. Okay, so this is the main cause, what I can say, that is creating that figure what I told you about. In India, it is 1 out of 6 trauma victims are dying, that we compare with the USA basically. So to address these particular challenges, the potential solution what I found is what I told, that we need a system basically, that should be a computer assisted system or detection system with the implementation of AI, where we can say that medical imaging for trauma care can be used. This is where we combine this artificial intelligence with the ocular imaging, so that it basically, we can say, will provide a faster, safer, and reliable trauma assessment. So if I move to the CAT system basically, so you are also are familiar, I think, with the CAT system. I will not go in much detail. So generally, CAT system offers our decision support to the medical professionals basically, or the peoples are there, and it does not replace the radiologist. And moreover, there are several examples we can see, like in cardiac diseases, there generally CAT tool play a very important role. Moreover, in eye diseases where we diagnose cataract, glaucoma, NDR, basically diabetic retinopathy. Moreover, in lung disease also. So in trauma care, CAT, this computer aided diagnosis system, has a great potential basically, I can say, that can provide a timely assessment, especially when every minute matters basically. So by integrating this overall computer CAT system in ocular imaging, uh, we can have benefits for such patients basically, and for diagnosis. So if I talk about brain, this traumatic patients basically, so this suffers from a brain injury basically. So basically we see that there is a major cause of this brain injury, and it basically occurs due to a sudden and forceful impact which happens on a head, or which disturbs the brain tissue basically, we can say. And it is a figure are there that most of the accidents are happens because of like motor accidents, vehicle accidents are 21%, and the object something is struck in your head. And moreover, like old peoples are there who are falling through the staircase and they get injury at that time. And due to the age factor also, we cannot generally get assessment like in a quickly way. So this creates this slight threatening injuries should need to be identified properly. Moreover, there should be proper management, so that briefly report as soon we can generate and provide. So the important picture here is that for this traumatic brain injury, the important parameter which I want to highlight is the intracranial pressure, which is in the brain. It's like a pressure which builds up in the brain, and we need to monitor this for patients with severe TBI patients, we can say. basically. So when I talk about the role of intracranial pressure in a brain injury, so according to some theory is there, Monroe Cayley, where he has suggested that this the cerebrospinal fluid and the intravascular blood and brain tissue, these are in a equilibrium position. Okay, so if one of some like brain tissue is disturbed or intracranial blood, then this pressure starts to build up, and this generally affects the brain tissue. And the major cause of this, that CSF fluid, that is cerebrospinal fluid, generally used to build up inside the brain. Okay, and if we talk about the normal range for the measurement of this ICP, so it is measurement in millimeters of mercury, and the normal range ranges from 17 to 15 mmHg for an adult. And what I talk that if in a brain, if this three components has been disturbed basically, so that will create a pressure basically. And if this pressure exceeded the 20 to 25 mmHg, so we need and treatment basically to reduce this ICP, intracranial pressure basically. And the available techniques, what I say, is the invasive measurements are there and a non-invasive. So you all know that invasive measurements is like when we performed any cutting or something like into the skin basically, and and through that it will create complications. And this is not, we can say that suitable for routine checkup basically, and repeated measurements we can't do. Moreover, when we talk about non-invasive side, so it does not require any skin breaking, and it is safer. What I talk about in this the imaging part, that we can use ocular ultrasound, fundus, or MRI, or something is there. So that is the non-invasive part. So when I talk about invasive measurements, so it consists of basically two popular gold standard. One is like catheter insertion and a lumbar puncture, we can say, where the catheter this when I talk about catheter insertion, so catheter insertion is basically done in two ways: intraventricular or extraventricular, uh, basically. So when I talk about interventricular extraventricular, that is a particular area we are particularly working out. So I will not go in much detail, but uh, initially, how we measure this basically, uh, whenever we need to do some measurement for ICP, we need to drill that particular brain through a drilling machine, and then insert a probe basically, and that particular probe is connected to a pressure device basically. And whenever we just get out that fluid basically, and we used to monitor that pressure, that we are taking out the fluid out. Similarly, in lumbar puncture, what we do, instead of brain, we used to generally at the back of the spine, we need to take the fluid through the spinal, that needle part, we can say. So these are very risky, you can say, the invasive methods. And the current methods which I talk, like non-invasive techniques, we are moving there, like a CT scan, MRI, ocular fundus imaging. So the advantage of ocular ultrasound here is that it is portable in nature, and moreover it allows for real-time imaging of the eye, so that patient can be treated at the bedside. Moreover, if we compare with the MRI and CT scan, so with MRI we can say that it does not require ionizing radiation, this ocular ultrasound, and it is safe for repeated use and assessing structure like retina, like part, and if we talk about ocular one, and an optic nerve basically. Moreover, fundus imaging is an alternative part, which also focuses on such key areas like retina, optic disc, and blood vessels. Okay, so but these two are ocular ultrasound and fundus imaging. What I say that is a much safer there, but people are working in all the four areas like CT, MRI, ocular, and fundus imaging. Okay, so uh, This is the where I show you a imaging where a diagnostic biomarker has been captured. Okay, so you can see here that we have a probe basically. Okay, so sorry. So a transducer probe we can see is placed gently over a closed eyelid, and whenever we capture in a real time in our hospitals, we used to place a gel over there before placing this ultrasound probe basically. And it generally works on the principle, as you know, on the sound. Okay, so when we place this, we capture the anterior chambers and the posterior chamber basically through this ultrasound probe in an eye, and also we reach to the retinal part and the optic nerve region basically. So here you can see another figure which is an ultrasound image, and I want to highlight here that two important biomarkers are there, like optic nerve basically here, and eye wall transverse diameter, which is there. Two basic biomarkers which is very important in measurement, or you can say in prediction of this intracranial pressure whenever it raises basically. So let me go into much depth. So if I talk about an optic nerve basically, so basically, and this optic nerve, I can say, generally is protected protected through three protective layers. That is a dura, arachnoid, and pia mater. What you can see here in figure A. Okay, so here you can see that that this is the optic nerve area. If I take some one circle, then the subset, like another part is pia, and then subarachnoid, then arachnoid, and dura mater. So this is a biological one. You can go in much depth in this. So when I talk about this optic nerve area, so in next B you can see that whenever this is the normal condition where I talk about the range basically. So I talk about the ICP range, which was 7 to 15 millimeter of mercury. But in the case of a person, if adult needs to we have normal range for optic nerve diameter, it should fall within the range of 5 mm, below 5 mm, or at the border of 5 mm. And if we go beyond like 5, so 5 to 6 is considered to be the moderate, and exceeding the 6 mm considers to be critical conditions where we need again a treatment basically, like regular monitoring of the patients. So here you can see that that whenever this fluid has increased there, that is a CSF fluid, so this optic nerve area has been dilated, so it has expanded basically. You can see this particular in this area. So because of this, what happens that in a brain, because of this pressure, the person mind does not work basically, and it may create a hemorrhage basically. So here you can see generally in an ultrasound image where a doctor so this is the part what I previously talked about. This is the eye wall, and this is the optic nerve, and the expansion part is like optic nerve diameter. So you can see this is the normal part, OND, and then where there is expansion, so this is ONSD we are talking about. And whenever we used to measure this, generally a doctor used to measure, so he used to measure through this retina part, and through there he perpendicularly draw a line, and then 3 mm basically, and then through that 3 mm below he will used to measure this OND or ONSD diameter basically. So this is a very important parameter, and this also has uh, like I can say clinical importance with the ICP. So next parameter which is there is the eye wall transmittimeter. This is a important parameter because lot of like automated study has been not done, because in recent years for optic nerve basically diameter measurement like automatically since 2019 what I say. So there are also not much literatures or something like work has been done. Still the work is going on, and the major problem is the data availability basically. But recently from 2023 you can see that the people are now giving the data basically. So this eye wall transfer diameter what I am talking, the next biomarker. Okay, so this you will not find in most of the this type of you can say imaging basically to measurement there. And this is important because in most of the literature has been highlighted that if you take the ratio of this optic nerve sheath diameter and eyeball, so it will be much beneficial to relate or correlate the things with the ICP basically. Okay, and the important thing of this that it generally when the patient that in adults basically, that if adults is grown up after some age, so this eyeball diameter does not vary much and it differs like 1 or 2 millimeter. And if I talk the average measurement for this for the I can say for the patients basically adults, so it is 23.7 mm. Okay, it may vary to from 21 to 24 also, but the average one is 23.70. So this what I said, that eyeball transfer diameter is a very important, and like it will play an important role in developing the ethnicity among the patients. Because when you see that if you see patient with a different age group like a Chinese people or Japanese, their eyes are similarly different, and their eyeball maybe sometimes like have different size basically. So that variation basically to solve that, to go through that variation basically, this eyeball transfer diameter is very important biomarker. Okay, so what why we need this biomarkers basically, so to develop an automated measurement system, so to monitor the intercandical pressure in traumatic conditions. So the important thing is that uh, to measure this ICP, we need some clinical biomarkers. So this ONSD and ETD plays a very important role. Moreover, if we talk about this measurement, what I talk about, the doctors is doing measuring perpendicular 3 mm and then getting the measurement for ONSD. So the machine which are there available in the ocular ultrasound, it uses the electronic caliper basically. So it has certain limitation. Moreover, if you see that are operator independent, so we uh, can't get the actual points basically during the measurement. So these are some basic some challenges which there in a real scenario we can find out. So this tells us that we need a real time system that should be automatically, and it should not delay the basically treatment and for the patients. So here you can see the video is playing, where you can see the most important challenge is that what I talk about, that the persons who are there, it is not skill. So this was captured a video file at this Jayaprakash Narayan Apex Trauma Center in New Delhi, where you can see, if I play, sorry. So if I play this video, you can see we are placing the ultrasound probe on the patients. These are trauma patients, and so we are capturing this image basically. You can see here. Okay, let me play this video, first video. Okay, so you can see that during this capture of the image, so this lot of images were generating. Okay, and you can see that this optic nerve area is not constant. It is varying with each image, and in some of the image, if proper gel placement is not there or the person is not scalized, so it will be very difficult to capture a good image where we can get the measurement of the biomarkers, which I talk like optic nerve sheath and eyeball transfers basically. So that two biomarker is very difficult to measure through such image, and doctor uses to face challenges because he can't capture this like if he captures that particular image also, but if it is not good, the parameters may change. Okay, so the important task challenge is to firstly, if you get some video files are there which having a multiple frames, so we need a good frame basically, we can say, to get that good frames for particular steps for measurement of optic nerve and eyeball transverse diameter. Okay, so you can see that lot of training is required here for the clinicians when we are trying to get the image acquisition. Okay, so this was the main challenge what we say. Okay, so because we are with the touch with the AIMS department and we are working, and so this all the problem has been given by the doctor which is there. It's Professor Deepak sir, Deepak Agarwal, who is a neurosurgeon there. Okay, so next, what I talk after this challenge was there. The another challenge with this ocular ultrasound image is the manual measurement. What I talk like with the help of electronic caliper, what we are doing, like uh, getting the like two boundaries basically. So what you see that the measure like firstly challenge was that whatever the image we acquired, it is good or not, we need to capture again. Moreover with that it may have limitations like of measurement also. So this is not feasible for regular monitoring because it has also some like guidelines that 5 to 10 seconds only we need, can be placed on a trauma patient. Beyond that we can't capture such images. So again if we are doing that thing, then it will harm the patient's brain basically. So moreover with that capturing of the image, so the thing is that we need to determine the exact boundaries basically, and that can be obtained when we get the relevant features from the optic nerve sheath diameter. And moreover the biomarkers which are there, we can't say it is like normalized or globalized, because if you see the if you study the literatures, this ONSD and ETD varies very much basically among the patients, and ICP has the correlation need to be developed basically. So we have another parameter with ONSD was the ETD, eyeball transverse diameter, and this was the like the fine image which we obtained. So you can see that around 429 like frames are there, and some frames are good, some frames are black are coming. So among these all, we need a frame which have a better view of optic nerve and eyeball basically. You can see that at this top of the boundaries are not clear, and all we can say that it will generally it's a very difficult challenge to solve this problem. Okay, so when I move, so the proposed solution we found, and that using existing CNN architecture, which I talk at the faster RCN. The idea was to choose this faster RCN because in medical we can't go for a one stage detector. We need a two stage detector, so we can. The accuracy is more important than the timing is also there for getting good results. So basically, whatever frames was there, we obtained through this video files. We extracted the particular images, and then generally we marked with the help of a clinicians the optic nerve area, and through that we trained those imaging, and then proposed some grading scale and further done the validation to verify this optic nerve detection and measurement part. Okay, so so this was the like faster RCN method which we generally use there. So generally it works on two stage layer, like reason proposal and reason interest pooling there. So I will not be going much in detail. So here we detected there. Moreover, we use the like transfer learning weights basically to get the feature extraction from that particular the learned features, and then using those features which are extracted.
Excuse me, sir. Sorry to interrupt. Can you please go back to that previous slide that you just skipped?
Okay, sure.
Previous. Okay, this one.
Okay.
Is it RNN or something different?
No, it is not RNN. It is faster RCNN, regional convolutional neural network. It is different thing. RNN is different. RNN is
Okay,
uh,
recurrent neural network.
yeah, it is faster. It's an object detection model, which you say. RNN works on different principle.
Okay.
Okay.
Yes.
So,
Thank you,
so
sir.
okay,
Sir, please show previous slide. Previous to the.
okay. This one.
Sir, hold 1 minute.
Is there any question? Hello.
So you can continue, sir.
Okay. Okay. So this is the what I talk about the fast charging methods. So do anyone need to explain this in detail? Because I think this is a generalized one now. People used to know all these things.
So it would be better, sir, please explain.
Okay, so in this, what I say that this works in a two-stage process. So here you can see in a figure basically. Okay, so this is the ultrasound image, and what I talk about that we done the labeling part. Okay, so labeling we generally know that in object detection wherever you are performing fast charging, or most of the people are now familiar with the YOLO network also. So they used to have some rectangular, like you can say what labeling we used to do in particular areas. So this was done with the help of an clinician, the staff which was there in the AIMS department, the optic nerve area. So after getting this particular this, we pass through a convert layer. This is a convolutional layer where we use a three model basically we use for testing: Inception and ResNet. In ResNet also we use ResNet 50 and ResNet 101 model, okay, to extract the feature. So passing the input image, this firstly through this I can say through this convolutional network, and the bounding boxes which we have created, the information which passes through this particular, okay, and based on some predefined grade system, we generate in a bounding boxes. So this information was coming like image features, the bounding box information, and then we are generating some proposals from the features, okay, and these generating bounding boxes are of different sizes, I can say, and aspect ratio, okay, as you can the fast charging method says, okay, and these bounding boxes are mapped as a feature map. Okay, and then there is a regional proposal layer. Where is my, okay? So this is a proposal layer where these bounding boxes are generated, and using this extracted feature, we refines the coordinates and scores basically for predicting the likelihood of the optic nerve sheath, because you can say whatever we have the like four axes. Now here you can see there's a four coordinates basically information there, okay, and whenever we are just predicting the score, so we will be using intersection over union information. I will be next slide I will be showing you. So here after generating some bounding boxes, because these are of different sizes and aspect ratio, so we need some fixed number of sub regions basically. So we use the ROI pooling layer, which is a region of interest layer, okay, that divides each proposal into a fixed number of sub regions. You can see here. Moreover, this step is used to ensure that we have a uniform size, allowing the next stage to process them efficiently. Because if different sizes are, that will be very difficult. Okay, so so the idea of this layer ROI is to get a uniform size, and then we use a softmax classifier, okay, to classify those regions to identify that that the optic nerve sheath is present or not there. Okay, moreover, if it is, if we got a score of 95%, like detection score, so we say that it is a good frame basically. So you can see here, this is the next slide which I talk about, where we get accepted feature and processing through, sorry, processing through two fully connected layers, that is layer 1 and layer 2. Layer 1 has been getting information about the bounding box prediction. Moreover, layer 2, like classifier we are doing and the probability we are obtaining. Okay, so this is the formula where we say that it is good or excellent when we have this area. So the overlapping is good, then it has in very good if it is like the with the ground truth, I can say the predicted one and the ground truth, the overlapping which are having. Okay, so this is the main idea there for getting a good frame. Moreover, with this, we also proposed, you can say, this grading criteria. Okay, where we have four criteria like overlapping windows, and if the detection score is less, basically 55%, then it is unexpectable. Moreover, the labels which are there, which are not like well classified, or the boundaries are not clear. So you can see here the five cases are there for quality. That is, first was unexpectable, that we cannot expect that if something is happening, then that detection score is 55 to 85%, then it's considered to be poor. And if it is close to 85 to 99%, okay, and this you can see the windows are differently coming. The one is showing 86% or another showing 90. So if it is there two overlap windows there, then we are not allowing those window. Okay, so we are rejecting those images basically as a good view. Moreover, the perfect one, we so that it is like good and excellent, we consider these two cases where if the score is 96, like 95% above or 99%. Okay, so this was the 4 and 5 score we have chosen. So moreover, the data set we collected, you know, that I've shown you the video from collected from the AIMS center, and we use for the initially for the 51 patients, we capture those video files, and we have lot of images there. So for training, we used like 17, 19 samples and 80 for testing basically, and using the ADAM, and then we obtained this loss functions basically, which is of bounding box and localization loss. Two type of losses were there. Okay, so we calculated for this inception V2 model ResNet 50N1, and then we also obtained crucial parameters like sensitivity and specificity, what I called. Okay, okay. So this was the grading criteria, and these are some results we got. Okay, for different patients basically, and then we done the subjective evaluation. We have two researchers basically, and four clinicians was there for such obtaining the mean opinion score. Basically, we consider for different cases, and whatever detection score we obtain, we get the opinion of like manual opinion from the peoples, and then finding the mean opinion score basically, and then correlated this with the generated and detection score what they are telling. So we got a correlation coefficient of 86 for the best score, which we considered like in the range of 95 to 99%. Then so for further measurement of ONSD, and here you can see that the good view score was calculated for different subjects, and then we have manually measured from the doctor side and automatically measured, and the difference basically. Okay, and then we compare those results and determine the percentage root mean square difference also. So if for 95 to 99 score, we get a good mean opinion score for the two clinicians and the two researchers, and a PRD of 0.51. Okay, so based on that, whatever good view frame I got, we then moved out frame for further pre-processing and the automated measurement of ONSD and ETD. Okay, and then the idea was to predict the raised intercandical pressure is present or not. Okay, so here you can see the full block diagram, which I have shared here. Okay, so after getting this good frame, basically we process for filtering operation, and then selected the like reason. I will go next slide where I discuss with each step. Okay, in filtering operation, we use the median filtering basically. So in a median filtering, basically the idea was there because we don't want to remove both of the artifacts basically, or the information which is there, because in medical imaging, like we do a lot of filtering, then information may, the important information will not be there. Okay, so simply we use the as ultrasound generally during acquisition have salt and paper noise basically. So we use the median filter, which is best to remove that. And further that lot of area you can see here is a redundant one, this black part. So we selected this particular region basically, okay, as a region of interest. And moreover, the idea was to identify this particular area, this optic nerve area. So we finally use the contour operation to get this information as this eyeball information, which see that it will be helpful for this ONS optic nerve area. Okay, then with this fitting, we extracted the optic nerve. Okay, and then we got this plotted this some after getting this, you can see the optic nerve area. We have generated an parabola like shape. Okay, and multiple parabolas were generated, and we varied three basically parameters like the focus of the parabola, and moreover we are changing the centroid position and the orientation of the nerve axis. And with this orientation, like with these changes, we obtained multiple parabolas, we can say. So the figure was like we calculated some figure. So it was 625, and then we measured the ONSD and ETD. Okay, and then this is a statistical which we get from analysis from AIMS in the control one. Hello. Hello. Okay, so this was the like statistical parameter obtained, and then if it is greater and less than, so we predict the raised ICP. So these are the some you can see figures and the detailing part procedure which we obtained, like median filtering we use, and then we get the region of interest and perform particular advanced image processing like morphological operations and thresholding using the contour operations, and then fitting the ellipse for doing the masking part, and then extracting this through auto-save binarization, because it was like selecting a manual one is not good, so we selected the auto-save binarization. It gives good results basically in our case, okay, in identifying the particular boundaries of the optic nerve area, and we identified the centroid part. Moreover, this is what I am talking about, that this optic nerve axis has been drawn, and since I talk in the initial part that through this yellow part is this the optic nerve tip region. Okay, so this tip region we used to draw perpendicular line and used to measure this measurement basically. Okay, so the idea was to first get this particular region, because as I talked in at the initial point, that with the pressure, what happened, this optic nerve used to dilate basically. In a slide I told you. Okay, so because of dilation, what happens, this area, if I talk about, it is like get dark and light transitions basically is there. And most of the areas, like if it is expanded, there will be a dark area. So to get the good like a particular region basically, so we draw multiple parabolas, and then we also plotted for each parabolas the intensity summation. Okay, so this you can see we plotted for each intensity summation curve, and wherever we get the maximum, this negative peak, the this is the one, the parabola which we are getting, so that we selected as the best parabola. Okay, so this is, you can see we plotted with a yellow line. Okay, the best one, which is the negative peak we are getting. Okay, and from this we just through Euclidean distance we get that 2 points pointed out, and then at 3 mm below we find this optic nerve sheath diameter range basically. Moreover, the another parameter which was there, like eyeball transmitter. So we have used the circle fitting basically, getting those particular area and keeping in mind this particular region should be there, not exceeding this region. So we obtain this measurement also, and then this is the observation parameter we then. So the age group which we obtained is in the range of 18 to 70. The patients was there, and we compared those results with the manually, and okay. So moreover, again we kept correlated with more data, and we obtained hello. Hello, hello. Okay, so we obtained a correlation value of
Shivletta sir.
Sir, can you mute that? Hello?
Please
Okay.
continue, sir. We are listening.
Okay, so we obtained a correlation value like 0.8 and some for this relation we have obtained. So we obtained with the ONSD alone an ICP relation where we obtained 6.9 particular value, and we are considering the the ratio of ONSD and IVOL transmitter. We got the relation like 0.81 correlation value. So this parameter we found that much better for predicting the raised intercandical pressure. Okay, so this is all the statics things we obtain with the data which we get from the AIMS department. So the threshold was defined like 0.21. Okay, so this is some validations we have done with the manually datas we obtained and sorry, with the automatic one. So here you can see that for the two samples I've shown here. Okay, so moreover, this is a summary that we get two biomarker which is very important in predicting the raised intercandical pressure. Moreover, the method which we used is a for ONSD measurement ETD is an advanced image processing techniques. So like in now a lot of people have started working with the deep learning as it comes. So people are working on, so I suggest you all if you can work on it using deep learning for obtaining this optic nerve sheath diameter automatically and ETD. Okay, so this is the overall integrated algorithm which we have obtained, that getting a good view frame on the algorithm, and then after some time we will obtain a this good frame then ETD value, and it will be representing that for what ICP level we are considering as a raised ICP. So this all instrument we implemented on a Raspberry Pi basically device. So the difficulty was with the timing part, because execution time was like very slow for this. So we use NVIDIA also, that was performed very well. So we whatever the system we developed there this through this algorithm and implemented on an Raspberry Pi and NVIDIA. So we done the real time this implementation by attaching this system to the ultrasound console machine which is present at the AIMS, and also we implemented the cloud based implementation. Okay, so this is the like overall implementation of our system, like the technician will be there available and our system will be connected to the ultrasound console machine. Okay, and capturing the image will generally be there, and during the in a real time, if with our algorithm which are there, through that if we get a good view frame, then it will highlight that the frame is detected and it will process for further measurement of this ONSD and ETD and calculate a ratio, and then we will say that the intercandical pressure which we obtained is a raised or not raised basically, and that information will be translated to the local expert, and moreover this diagnostic representation will also be go to the remote centers basically, okay, through cloud based. Okay, moreover this was the cloud based implementation we done through S3W bucket. Okay, so using those bucket we generally like get the data uploaded to the AIMS in a particular data bucket basically, and our algorithms was like connected through the center, and then we used to process those data and all the results were calculated to the algorithm, and the information reaches to the clinicians like doctors, and then he can recommend some consultations basically. So these two type of implementation we basically do for prediction based ICP. So this is the setup we basically I show you for Raspberry Pi. We obtain running these algorithms. Okay, so this is all. Then we done the validation part through this cloud form also. Okay, so the same like comparing the values with the whatever the operators we are having, two operators we used here. Okay, then we obtained some for the system like what is the accuracy and all that. So we are generally
Sir,
getting.
can you please show Raspberry Pi slide?
Okay,
Raspberry Pi.
Yes, ma'am.
Okay, sir, just 1 minute.
Yes. Any question? Hello? Ma'am, any question from your side?
No, sir, actually, I just wanted to note down. That's why.
Okay. No, actually, we use the model B basically. Now the new models also came, like 5 and all that.
This is the
Okay.
hardware part, no? Raspberry Pi chips.
Yes, sir. This is the hardware part. Okay. And this
And
we
it
have
is
a
used for that sensing.
no,
Sensing.
actually, yes, and the data which we transfer, that it will go through it and sense all the things.
Okay, sir. And sir, please share your email ID so that we can reach you out.
Okay, okay. I will sure share with you. Okay.
Yes. Thank you.
So this is the initially when we started work, we work with the Sonosite machine there, and later on we moved to the Sonosite, that is different machine, that is H2, and we validated the performance with this machine also, and we are getting good results basically. Okay, so accuracy for overall system we obtained like 90.3%. We obtained, not good we can say, but it is like we can say that it is as an initial stage good one. Okay, moreover we obtain a sensitive for abnormal cases like 92.37%, and for correctly like without raised ICP we have got 85.41. Okay, and we also obtain a kappa score where we got 0.77 for predicting this intercandical pressure. So this is the ROCL. Moreover, I need to also focus on this fundus imaging, which I there, because the key the idea is to tell you this because ocular ultrasound is popular one. Okay, and fundus imaging, what I need to say that is an alternative one because you can say that a lot of people are working on this, and it has been explored for glaucoma like diseases, cataract, diabetic, it's like different stages we can say. But for monitoring of intracandical pressure, this fundus image has less explored basically what I say. Okay, and there are several parameters like people used to do segmentation of optic cup and disc, and then they diagnose glaucoma. Okay, but the important parameter which can relate to the ICP is the artery and vein, we can say the blood vessels which are available there, and the normal range for healthy patients is it's in the ratio of 2:3. Okay, that is a artery upon vein ratio we can say. So it's something value can 0.63. Okay, so if it is less than 0.5, like the ratio is 1:2, then the patient like a mild hypertension conditions will be there. Okay, similarly this optic cup and disc ratio is also there. Okay, for healthy sorry, for healthy adults it's ranges for 0.3 to 0.5, and if it is less than 0.25 the hypertension exists basically. Okay, so this is a very important area which has not been explored with a lot of the people. Okay, and people are working only on the glaucoma, cataract, and this thing. Okay, so this intracandical pressure we can start with. You can if you have some data and all that. Okay, and this is important because this intercandical pressure, as you know, that it's in the brain basically, and it also affects this artery and veins. Okay, instead of what I talk about the recent through ocular ultrasound, the optic nerve and ETD basically. So these are other biomarkers which you can explore. So this is a simple biomarker lessons, you all know about it. I think a lot of people if we are working on it. Okay, so I will not go in much in detail in this. Okay, so the challenges is like in artery veins. The important part is that veins play a very important part. Okay, and it is very crucial. Moreover, whenever a lot of people have done segmentation, also working on artery veins, but the challenge lies in the extracting the thin blood vessels of those artery and veins is very important, which generally leaves, and that may create complications later on. Okay, if we did not diagnose properly. Moreover, for monitoring of ICP, you can explore these biomarkers. Okay, so we have also get an algorithm on this for automatically predicting the artery and vein. So we done the pre-processing simply normalization and using our two different deep learning network, basically the existing one, and then extracting the artery and vein information. Okay, so and then we done the validation part. So we did not generally we are working on it basically for monitoring of ICP. Okay, so I will move out. So this is a normal steps which we done for pre-processing, and then segmentation went then to the efficient network and unit as a decoder. So it is a hybrid model we basically use with the efficient B7 and unit. Okay, to obtain this artery and vein. Moreover, for optic curve disc, we use the existing this DCG net, and then these are the some steps which we involved, like selection of blood vessels and then pre-processing of vessels. Moreover, we targeted the important regions and then determine the vessels area and diameter. So we have done some hyper tuning with this. We use a three type of data set like RITE, HRF, and LES for segmentation, and Drishti GS, and there are other also again from Drishti GS you can see there are refugee rim one other data set, but we worked on the Drishti GS for optic up and disk, and this is all set up. So this was the performance we evaluated basically uh, with the diagnostic biomarker where we obtained a good sensitivity and specificity. Moreover, we have done a Bladman plot we have done, and this is the again we have done the manual measurement. So we compare with the data set which is the is there a inspired is there when some data set is there. So we worked on that and validated the algorithm. I could not recall here. Okay, but we validated with that particular data set because that is the only data set available for 40 patients, and in that they have labeled the value for artery vein ratio basically. So when we worked with other images and compared results then with those manual one, so where we obtained an average error of 0.15. Moreover, I want to highlight this that the tool which we use, because the data which we obtained is in the form of DICOM files. So we use the DICOM software basically in extracting the information and other things also. So I want to just highlight this. If someone are familiar, they can work with this DCM file format also. Like people used to convert those in PNG and other things, but the DCM format is a very good one. Okay, so that's all from my side. Okay, hello. Is there any question now till now from your side?
Any question, please?
Excuse me, sir.
Yes.
Sir, in one of the slides, you have shown some p-values. So that p-value is meant for which hypothesis test?
Now where I'm, yeah, just tell me.
Some p-value you had shown. Is that for hypothesis test or something else?
So for statistical, we have done basically. I think you're talking about p-value here in analysis part. We have done
Yes,
here.
statistical analysis.
Yeah. Okay. Yeah, we for statistical analysis we have done hypothesis part.
So that which hypothesis test you have used, sir?
Actually, I could not remember that. Okay, because some other people are working with me. Okay,
Okay.
but I will let you know.
Okay, sir.
Okay. Moreover, I want to also let you know that this data which I am having, okay, is an like you can say we can't share with everyone. Like if you're asking with me, so if you want to really work on this there, so recently you can just this link is there. This public data set is there, so you can download this. This
Can you
link.
please type it in the chat box?
Yeah, I will share you this
Copy
link.
paste.
Okay, I will just share this link. So you can download this data, and there is also a manual values are there, and then you can work out on particular things, deep learning models also. Okay, just a minute. It's there. In the chat box. Okay. So I've shared with you. So
Thank
if
you, sir.
anyone wants to work on it, they can start working with this. Okay. Okay, so any questions? Hello.
Any question?
Because I left 15 minutes for questionnaire.
Yeah.
Sir, how's the edge detection system works, sir, in your slide that
Just a minute. Here you are talking about?
previous slide, sir?
Just a minute.
No, next slide, sir.
Okay, here?
चांद देखते फिर दूसरा
Yes,
चांद देखते
five,
फिर
five.
तीसरा चांद देखते
V.
Hello.
2 महीने में 3 चांद देखते लेकिन रसूलुल्लाह सल्लल्लाहु अलैहि वसल्लम के घर में आग नहीं
Yes, sir.
जलती
This one.
मैंने कहा
Yeah, this one you're talking about, na?
No, previous one, sir.
पर होता था
This one?
Yes, sir. The point V point, sir. 5 point. Extraction of optic nerve system, sir.
Yeah. So what happens? So, sir, can you repeat?
मेरे बहन जी हम एक चांद देखते फिर दूसरे चांद देखते और फिर तीसरे चांद देखते
Hello.
2 महीने
Sir, can you meet?
लेकिन रसूलुल्लाह सल्लल्लाहु अलैहि वसल्लम के घरों में आग नहीं जलती थी मैंने कहा खाला जान फिर आपका गुजरा किस चीज
Dear
पर
participant, please mute.
उन्होंने फरमाया 2 काली चीजों पर यानी खजूर और पानी पर
Hello.
Any question, please?
Yes, sir. So this is not the actual one. Okay. What I'm talking about. Okay. So what happens that in our process, like this was the core area. Okay. And this optic nerve was the reason which we need to extract. For that, we have done this ellipse fitting. And sorry, here when we use, we're talking about the edge detection. So we use we also done that thresholding also to detect this edge part. For that, it is not like properly extracting those information, the B boundaries basically, but or to say, as you know, that it's work on different principles. So it has a like extracted the part of edges part. Moreover, and this is also not a final part we have the edging we can say. So for that we perform this parabola operations here.
Okay, sir. What
Hello.
is that blue one in the middle?
Blue one where?
Yeah, that extraction of optic nerve. That slide, sir, only. Yes.
This
Yeah, the middle one, the blue dot.
that is the center of the optic nerve.
Okay. That is
Because
defined by you, sir, or detected by system?
detected by system.
Okay, sir.
Because that is very important, because what happens that when we used to find this this region, so basically we are interested with the centroid area and the center of the region is used to called as globe. This eye wall also, this region used to called as globe. So why we are interested? Because what I told that this centroid and this centroid we used to draw a simple line. We join this particular center protection and this optic nerve centroid, and to vary the parabola basically what we done, we vary the focus of parabola and shifting plus 5 plus 10, you can say plus 5 to the right side to the centroid, and plus 5 and plus 5 to the right side. So we get 5 different positions basically, and on that 5 different positions we draw this parabolas basically, so that we can get the this when this optic nerve used to dilate basically, so we can get the particular key areas, you can say, like here you can say we have done, we have just, you can see this figure is there, just zoom it. Okay, you can see here, no, this is the centroid we pointed out, and then through the centroid 2 plus 5 minus 1 we have other points we have this get the distance moreover to this side, and then draw based on these multiple parabolas, so we can get the exact the the boundaries of the seat basically.
Okay, thank you, sir.
And moreover, this you can see this was plotted like uh, since you can see this is a very dark part, and when you come down, like we done the raster scanning operation also through this area, like performing like left to right operations, and whenever we got this particular area, because this is the retina part. Okay, so in this retina part, whenever we get some like informations like some pixel values, so we used to point this as the this yellow point optic nerve tip. We used to call this optic nerve tip. So this is helpful when like through this when we draw the parabola and through the two boundaries like this and this are the 2 points. So if I need to measure this now, where I want measure, so from this optic nerve to this yellow part, we will come down perpendicularly 3 mm down, and then to that particular point we will select this yellow one and measure the ONSD value. Hello, is it
Sir.
okay?
Yes, yes, sir. Thank you, sir.
Any other question?
Any other question?
I think no question, sir.
Okay, sir.
Okay. Thank you, sir. Thank you for a valuable talk and very good interaction also with the participants.
Yes, sir.
And
Thank
it
you
is
also for inviting me for such a
yes, sir.
beautiful sessions.
So in future also in our next program we'll invite you most
Yes,
probably.
sir.
Okay,
Yes,
sir.
sir.
Thank you, sir. Thank you very much.
Oh,
So dear participants, just after just at 7:30 we'll start the next session. Please leave now, sir.
yes, sir. Okay, can I leave?
Sir, excuse me, sir.
Yes, yes.
Sir, actually, what are the different types of biomarkers used in this field?
No, basically, when I talk about, see, in a medical, there are a lot of biomarkers. First thing is you need to clear. And second thing, in which key area you need to work out. So if I talk about, in my case, when I talk about the trauma patients, so I'm working on the ocular ultrasound image. So in that ocular ultrasound image, the two key biomarkers which I focused on, the optic nerve diameter and the eye wall transfer diameter. There are other parameters also, but you need to get the data like retinal detachment also you can work out through ocular ultrasound. Okay, so these three key biomarkers people are working on. Moreover, if you go to the
Is
another
there
or
any or brain tumor detection like that?
no, brain tumor detection is totally different. Okay,
Okay, sir.
we can't get because this is an ocular part. Through the ocular we are getting this ocular ultrasound. For brain we use CT scan or MRI, and brain part differently we get, so that is different thing.
Okay, sir.
Okay, so the main objective here to predict the intracranial pressure, because if you search out, it is very important parameter for trauma patients. Okay, and regular monitoring is must. So what is my idea is in this work that we can't go for CT and MRI. Okay, and we need a very effective tool like ocular ultrasound. Okay, and through ocular ultrasound it is like easily carryable also, and we can easily get the ultrasound image of the eye. And the importance what I need to focus here, that you can say that people used to generally having an eye checkup regular ways. Okay, so if we can, because you can see during that examination also when people used to go for eye, people used to get that another pressure, that is the intraocular pressure. You have heard about it, I think. Okay, so eye pressure which used to measure through some instrument is the tachometer. I could not get some name is there like this. Okay, through that we used to put some pressure on like through that, and we measure that pressure. Okay, so this intracranial pressure can also be related, and it will be helpful for some patients like in sports injuries we can say. Okay, or in some accidents Like sometimes in primary cases, we don't know what injuries are there, but later on it's move into brain tumor, what you talk about recent just now, brain
Yes.
tumor and other things. Okay, so this pressure used to build up because the CSF fluid is to increase, and then this what I say, this information came where we need to reduce the ICP pressure or other parameters. Okay.
Okay. Thank you, sir.
Okay, sir. So can I leave now?
Okay, sir. Okay, sir. Please.
Okay, thank you so much.
Thank you, sir. Thank you very much.